What is our oral microbiome and how does the oral microbiome impact our health both positively and potentially negatively?
Yes. So this is a concept many people aren't aware of. So thank you for giving me an opportunity to amplify this education. So many of us are aware of the gut microbiome. The
Yeah.
Human Genome Project really put that in the vernacular. And I think people are now realizing how important the gut microbiome is to whole body health, systemic health, look to the gut. But what doesn't get enough attention is the oral microbiome. And
Mm,
so the mouth is the gut. And I want everyone to
mm,
start thinking of it that way. It's all one tube, it's the beginning of the gut. And so what happens in the mouth doesn't stay in the mouth. And we do have a microbiome of the mouth called the oral microbiome. And interestingly, in the oral microbiome in the mouth, there are different niches. So there's multiple
mm.
different little microbiomes in your mouth. So the
Wow.
bacteria on your teeth will be different than those around your gum tissue and on your tonsils versus your tongue, etc. So it's essentially the ecosystem of the bacteria, the viruses, the fungi, the protozoa within the mouth, and how do they live in symbiotic happiness, or are they in dysbiosis?
Mm,
And dysbiosis is when we have disease. And dental disease, cavities, gum diseases, they are the top chronic disease globally in
wow.
children and adults. Many people do not realize this. And I think we just have normalized it so much. And I'm trying to change that. What's common isn't normal. We should not be having bleeding gums, inflammation in our gums. Our teeth should not be decaying. The enamel's the hardest substance in the body. And
Mm,
if it's dissolving and essentially rotting, not a technical term, but decaying, creating cavitations. That is not typical. And we can dig into this more, but it's important to know that humans are the only species besides domesticated pets that get decay.
wow.
The wolf in the woods or the deer, they're not getting dental decay. And this is because of our diet. And
Mm,
that's because our diet is changing our microbiome, our oral microbiome. And also important to know, we swallow 2,000 times a day. So if you have imbalanced bacteria in your mouth because you have gum disease or periodontal disease or cavities, what is that doing downstream to the gut? And so we do know there is the oral gut axis, and that can be influencing gut health. And we can get into it more, but essentially
yeah.
the oral microbiome, it can influence every system in the body. So it's something that we really want to be taking seriously if we're looking for long-term health and wellness.
Yeah, it's the entrance to everything, right? So if it's negative, then that's going to have a domino effect on everything else, like you said. And that leads me to ask what harms our oral microbiome the most? You said our diet, but what some specific things in our diet that's really causing the oral microbiome to be harmed?
Yes. So, if you look ancestrally about 10 to 12,000 years ago, and if you look at a human skull and the dentition, you'll know there are no cavities. There
Wow.
were some tribes, of course, that would get decay. They usually were in areas where there was really high fruit content or honey. So, flash forward to the agricultural revolution. So, we went from a hunter gatherer society to an agrarian society. We started mass producing, corn and soy and wheat. And then comes the industrial revolution where we started milling and processing and adding flour and sugar to everything.
Mm,
So, beneficial bacteria, commensal bacteria, they love prebiotics. So I teach the kids at my office, eat the rainbow. Rainbow foods, the polyphenols, the vegetables, the fruits, they feed our healthy bacteria. And we know this with gut health, right? We're taking prebiotics, probiotics, postbiotics now, but it's the prebiotics that really are the fertilizer. And
mm,
so we want to be eating a wide range of colorful foods to feed healthy bacteria, and as well as fermented foods because that helps boost the bacteria that is there, right?
yeah.
The cultures. So that is what helps your oral microbiome. And there are things that can also damage it. besides food, but we'll get into that. So then what is feeding the bad bacteria are the fermentable carbohydrates. So it's the sugar and the flour. And this is why we saw such a surge in dental disease and decay after the Industrial Revolution,
Mm,
and now continuing flash forward to present day, where it really is rampant. Um, and it's where we keep saying, "Well, use this product to correct the issue," but we're ignoring the elephant in the room, which is our food and our food system and our ultra processed foods and our dependency on the bliss, the taking advantage of the bliss point by these food scientists to make us over consume these hyper palatable foods that are influencing the microbiome. And they're not only feeding the microbiome what they need, which are the fermentable carbohydrates, the sugar, and the flour. I need everyone to understand flour is sugar in the mouth, but also the preservatives and the food dyes and the artificial flavorings and these extra ingredients, they are changing the landscape of the microbiome too. So anything you put in your mouth is going to alter the microbiome either toward health or toward disease. And so it's important to think of this with every fork full or
mm,
spoonful of food or drink that you put in your mouth. So food is the top thing, but other things, certainly the products you use. So we use a lot of antiseptic, antimicrobial mouthwashes and toothpaste that have damaging ingredients in them, and they're shifting the oral microbiome too. So we need to be looking at our oral health care products differently, just like we're looking at our cosmetics differently, just like we're reading food labels. We need to be reading our oral health care ingredients as well and thinking, is this supporting my microbiome or could this be damaging it? Mouth breathing too. So as a functional dentist, I speak a lot about airway health. And we do know our saliva is incredibly beneficial for the health of our mouth and our body. And we don't think much about how important spit is, but it's
mm,
incredibly important. I want people to start really cherishing it. So you need to be hydrated. Your spit has enzymes, it has healthy bacteria, it has immune cells. It does a lot of nutrient exchange and mineral exchange with your teeth. So the hydration of your mouth is important, but if you breathe through your mouth, you lose your salivary health. So you get dry mouth. And patients with dry mouth tend to get more dental disease. And that is because pathogenic bacteria love acid. So this is the other part. It's
mm,
not just sugar and flour, but it's acid or low pH. And this is where we get into trouble with many of our drinks. People think, oh, it's sparkling water, it's healthier. And that may be true, but we need to think about acidity and pH.
mm,
So the bad bacteria in our mouth, they love an acidic environment. And when you breathe through your mouth and your mouth dries out, your mouth becomes more acidic. And it creates this perfect breeding ground for these bad bacteria to thrive. So as you can see, it's pretty multifaceted.
yeah.
Um, but if we can look at dentistry differently and not just focus on end stage disease, and end stage disease is when you're going in for a filling, when you're going in for a deep cleaning, that's dealing with end stage disease. If we could get upstream and just check a few boxes, like making sure we're nutrient optimized and we're feeding the healthy bacteria, not the pathogenic bacteria. We're breathing through our noses, not our mouths. We're making sure our gut health is optimized too. The gut influences the mouth. If we check some of these boxes, I really do think that we can fix the disease crisis that's happening right now with oral health.
That's really, really important. Really interesting things as well, like the flour thing. I didn't. Is flour? Are you saying flour is a sugar, or it has the same effects as sugar in the
The
mouth?
way it's broken down into the mouth
Yeah.
by the enzymes in your mouth, it turns to sugar and it feeds the
Wow.
bad bacteria. So, um, cavities are rampant in children now. And so many people think, I hear parents come in all the time, well, they don't drink soda. My kids don't eat candy. What is it? And I say, well, tell me about their diet. And so many of them are eating goldfish crackers, dried cereal, sticky gummy fruit snacks or fruit leathers, even dried fruit. So it has to do with the consistency. It's sticky too. A
Mm,
lot of toast and bagels and breads. these carbohydrates, and they do. And I'm not advocating to say never, but we have to think, what is this food doing to our bacteria? I want people to start thinking of that. Am I feeding, as I teach the kids, am I feeding the good guys or am I feeding the bad guys right
Mm,
now? We obviously want more good guys in our body than bad guys. So we want more healthy bacteria than pathogenic bacteria. And that is because we're learning these pathogenic bacteria can really influence other parts of our body. They can, so if your gums bleed, I want people to start thinking about the concept of leaky gums. Okay, so we think of leaky gut or intestinal permeability. Well, if your gums bleed, now that is a entry point, a vector for the bacteria to get into your system, your circulatory system. So these bacteria can get into the system, they get into the circulatory system, the lymphatic system, and they end up in places they shouldn't,
mm,
like your heart or your liver or your uterus or your brain, okay? Your joints. So we're finding that an imbalanced oral microbiome and very specific bacteria are linked to Alzheimer's and dementia, cardiovascular issues, high blood pressure, cancer, rheumatoid arthritis and autoimmune disease, fertility issues, pregnancy outcome challenges, like honestly, miscarriages. So, especially once you start getting into periodontal disease, um, and that's when you start losing bone around your mouth. That's a chronic end stage disease that we really can have some downstream effects that impact the other parts of the body. And so, it's not only the bacteria themselves, but the bacteria release lipopolysaccharides and endotoxins, exotoxins. Essentially, they create inflammation in the body in places they shouldn't. And so you have an immune response to this and a cytokine response.
mm,
And this is not ideal. So people really, again, I think dentistry's always been kind of the joke of medicine, and it's just not taken seriously. And the mouth has been separated from the body, but we need to bring it back in, and especially for someone that's really trying to optimize their life, be the healthiest human they can be for as long as they can be that, they have to be focusing on their oral health too.
mm. And when you say bleeding gums, is that also when you're brushing your teeth and they start bleeding? Is that the
Yeah.
same? Really?
Yes, you should have no blood. So if we call it pink in the sink. So if you routinely floss or brush, and this is what we're missing, people don't floss enough. I want
Mm,
everyone who listens to this to become an avid flosser. If I had to pick between brushing and flossing, I think flossing is so much more important because it's removing the biofilm, the bacteria from between your teeth. Everyone thinks it's just you floss to get food out. That's not true. We're removing the biofilm, the sticky bacteria that come and cling to your teeth. We're shaking them off like a rug
mm,
because I don't want them to sit there so long that they can release acids, cause inflammation, leach minerals out of your teeth. The bummer is they come back again. Now, they come back again at a rate depending on what you're eating. So if you eat mostly vegetables and fruit and meat and things from the earth and from farms and less processed carbs, you won't have a lot of these bad bacteria. You won't have a lot of plaque. But if you
mm,
eat a really high carb diet, a lot of more modern foods, you're going to have these bacteria come back quickly. So flossing is really important to remove that biofilm, but it stimulates your gum tissue. It kind of strengthens it. Think about if you start playing a guitar for the first time, your fingers get really raw, right? You need to practice to get those calluses. It's the same with your gums. So the more you floss, your gums are going to get stronger and more resilient, but we shouldn't be spitting into the sink and seeing pink or red. Um, of course, maybe here or there, a spot here or there, but if it is chronic and consistent, you have gum disease. And so people might say, my gosh, okay, well, what do I do aside from some of the strategies I spoke of? And we'll go through a targeted list at the end to recap. You can now oral microbiome test. So just like we do gut mapping through stool testing, you can test your spit and you can find out what bacteria at what ratio are in your mouth, which is really cool. I have a close family member who's very healthy. She's in her 80s, but I thought, you know what? Let's just test your microbiome. And because she has a family history of colon cancer. And so we tested her, and she was through the roof with a bacteria called F. nucleatum. Now, she'd always gotten wonderful dental checkups every time she goes in every 6 months religiously, but she has this bacteria in her body that has been linked to colon cancer. It's
Wow.
also linked to pancreatic cancer. And so she has no signs or symptoms yet, but this is the point of catching things upstream. So imagine if you're in your 30s or your 40s and you're routinely testing your oral microbiome because it does shift and change as we age and based on different exposures. And you realize, oh my goodness, I have P. gingivalis, another bad bacteria that's linked to Alzheimer's. I have that through the roof. I'm going to do some strategies to eradicate that or at least lessen the ratio, get my oral microbiome more balanced. By doing that, I'm reducing my risk of Alzheimer's and dementia. But the Alzheimer's and dementia may not become apparent for another couple of decades.
No.
This is the upstream effect. We need to be looking at root causes and taking a preventative approach. And so there are direct to consumer oral microbiome tests, which is really cool. And it could not be easier. You literally just spit into a tube and mail it off. And some of the companies that I like the most, they're using shotgun metagenomics, which is giving you the full sequence and DNA varietals of everything in your mouth, which is really cool. And they're working on also determining how they interact together and how this ratio of bacteria influence each other. And it's really cool. It's an exciting time. And the oral microbiome is still, I would say, in its infancy, and it's about ready to blow up a lot like the gut microbiome has.
Definitely, and hopefully it does soon. That's really cool with the oral testing. That's amazing. And
Yes,
you said your 8-year-old family member had like a good diet, but they were still high
yes.
in this bad bacteria. So what would be the other likely causes of
Yeah.
that?
Yeah, it's hard to say. So it's the terrain theory. So just something in her body was allowing this bacteria to take hold. And she did have an excellent diet, but I do know for a fact that she breathes through her mouth at night. Okay, she snores. So that could be it. Um, she is older, so her immune system isn't as active as it used to be. I don't think she's using the most ideal dental products. So at some point, she was inoculated with this bacteria, and then something in her body has just allowed it to kind of slowly grow over time to a point where it's at a more concerning level. But there are really great strategies. I started to have her water pick with hypochlorous acid. You can use tea tree oil or oregano. Ozone works really great. Iodine, silver, nano silver. But then some of these bacteria, they actually do need antibiotic treatment too. And this is where you need to work with a forward thinking, functional dentist. And that's the hardest part with these conversations is people will be listening saying, my gosh, I want this type of care and treatment. And it's not standard of care yet, like some of these things, but we're working toward that. I mean, we're in the beginning of this movement, I think, where we are modernizing and changing dentistry. And soon, I hope that microbiome testing is done in every dental office, just standard of care, as it should be. Because otherwise, we're flying blind. We have no data. That's the critique of dentistry is we never gather data. We're not testing our patients. I don't know my patients' vitamin D levels or their mineral levels or what their gut health is. Do they have parasites? What's their oral microbiome like? We just look at x-rays or look in the mouth and we're scraping away hardened plaque and then we're filling holes that we see, but there's really no metrics or data. And so we are trying to change that. And that's where functional dentistry comes in.
Yeah. And why hasn't there been that movement earlier, previous decades?
Great question. I do not know the answer. Um, I think people get set in their ways. It's really hard to disrupt an industry. The I think also it's an overwhelming transition because there is so much dental disease.
Mm,
How if you're constantly putting out fires all day in your office because it's cavity after gum disease, after periodontal disease, after root canal, how can you take a step back and say, wait, I want to now do an upstream approach. It's a complete 180, right? You need to take this huge intake with the patient. You need to spend so much more time with them, working them up, understanding what their mediators and triggers and antecedents were through their life that led them to the place they are now. You have to do food journaling. You really need to get to know your patient on a deeper level.
Mm.
And standard dentistry isn't set up that way. Um, so I do envision the only way this will work is dentistry really does need to be separated sort of into two entities in the sense. And medicine's done this to some degree where you have family care physicians or physicians that work patients up, right? And target them from that standpoint. And then you have more surgeons that deal with the end stage
Mm.
disease. So in dentistry, that would be a more of a physician of the mouth versus a technician or surgeon. Because we do need those. We need dentists that can fix teeth, that can do crowns, that can do root canals. But we can't just be looking at the fixing. We need to be looking truly at the prevention and the course correcting. And that's what's really missing is we're not giving patients the tools and education they need to really understand their mouth and to get healthy. And it's funny because when I have these conversations and so many people, I mean, you can see they're just mind blown. They're like, I had
Mm.
no idea that my mouth was so important. I didn't even
Yeah.
really know what a cavity was. I actually didn't know we weren't supposed to get cavities. I just thought that was part of life. So it's a big educational shift and mindset shift. But I do believe it's going to have to come from the public,
Mm.
kind of a ground up approach. And maybe there'll be some top down. I mean, hopefully we meet in the middle, but that's why I appreciate this opportunity because we need patients demanding change and the dentistry is a business, okay, whether we like it or not. And so the business is going to change based on consumer demands. All
Mm.
right. So if you stop seeing this dentist because the guy down the street or the woman across the river is doing things differently and they're microbiome testing or they're at least having these conversations, the person you just left is going to have to sit and looking like, I need to update my practice. I need to go back to school. I need to learn about this stuff because my business is suffering.
Mm. Yeah. It's all about incentives, making them both aligned with the business side of things and also the human side of things. So
Right.
aligning them would be ideal. And in terms of shifting things as well, carbohydrates, well, processed carbohydrates, you've mentioned, are a big culprit of some of the problems we have with our oral health. What is the ideal diet, do you think, that can optimize our oral health? And where do processed carbohydrates fit into this, or do they at all?
Yeah.
Wait, hold that thought. I'm genuinely so grateful that you've stuck around with us to listen to these fascinating insights from the guest so far. If this episode has given you one piece of knowledge which has helped you understand yourself and the world a little bit better than before, the absolute best way to support us is to pay it forward and hit the share button right now. Don't let this knowledge stay hidden. Please send it to one person who will benefit from this episode. Thank you so much. Let's dive back into the rest of the episode.
So we, I believe we're meant to be omnivores. This is up for debate, and I'm not here to advocate for one diet or another, but as minimally processed whole food diet as possible. And I mean, this is not new. This shouldn't be news to anyone who's interested in health and wellness. So quality meats and dairy and fish and if you can tolerate dairy, right? A wide range of vegetables, all the colors and fruit. Not all day fruit because fruit can potentially cause cavities. And I do hear colleagues who I respect very much kind of villainize fruit. I can tell you right now, fruit is not the reason we have a dental disease epidemic. Like it's just not. It worries me a lot less. This is getting nitpicky and I think isn't really helping the movement personally. So nuts and seeds and fermented foods like sauerkraut and naturally fermented pickles and olives and kimchi and kefir. um, and organ meat, or at least supplementing with organs. We are lacking minerals in our diet. So
Yeah.
more seafood, and there's certain things that I think we really do need to be supplementing, okay? Because we're just so deficient. And eggs, of course, if you can tolerate eggs. So again, I teach the kids at my office things that come from the earth and from farms and not from factories.
Mm.
Now, I do think when you become overly strict, I worry about mental health issues and emotional health, right? We also are in modern society. So I like patients to adopt an 80-20 or even a 90-10 principle, where a majority of the time, and especially I tell parents of children, keep the house pretty pristine with food. Like, this is our sanctuary. So what you bring into the home, what you're cooking, the snacks, it's pretty clean.
Mm.
But we all know when we go out to a restaurant, to grandma's house, the after soccer game snack, it's probably going to be not optimized, right?
Yeah.
And that's okay. And so if we are eating foods like this or drinks, it's important to have really great oral hygiene, so you have to be flossing and brushing. I like tongue scraping too. That's taking like a stainless steel or copper wire to clean the bacteria off your tongue. And people will say, well, can't I just use my toothbrush? You can, but keep a separate toothbrush. Okay, there's different bacteria, but a tongue scraper does do a better job, and it will stimulate the lymphatic system a little bit. And if you purchase a tongue scraper, you can have it your whole life. One
Huh.
tongue scraper, it should last you honestly quite a long time, decades, if you take care of it. Um, but we do have to have great hygiene if we're eating these foods.
Yeah.
But the important thing that I really want to hit upon, it's not only about what you're eating, but it's how frequently you're eating it. So there's something called the Stefan curve. And people can look it up and search it, but essentially it shows the pH changes in the mouth after we eat and drink. And this is normal. So our teeth naturally, anytime you put something into the mouth, the pH of your mouth drops because it's digestion. This is the beginning of digestion, the mouth. So the pH drops to start to break down our food. But then if we give the mouth time to rest, which we should be doing, our saliva, if it's healthy, it's filled with all these wonderful minerals. It comes in, it buffers, and it raises the pH again. It's important to note when the pH lowers in the mouth, you will have some demineralization of your teeth. That means minerals will be pulled out of your teeth. Your teeth are a little vulnerable at this point, which is why I don't love people running and brushing their teeth right after they eat,
Mm.
because their teeth are a little vulnerable. Those bristles can wear away enamel, and over time you might get enamel wear sensitivity. So it's really ideal to wait about 30 minutes. That's when we start to see the buffering and the remineralization happening. Here's the problem. We eat all the time. We are grabbing a bunch of crackers, chewing them, talking, doing something, coming back, grabbing more crackers, chew. We are eating sometimes every 5, 10, 15, 20 minutes, just mindless snacking. And it's not only food, it's your drinks. And this is a big problem people don't realize. The sipping on drinks, whether it's coffee with sugar in it, or the Starbucks drinks are the biggest villain I think out there. Um, or your kombucha or your sparkling water or your Gatorade or what have you. If you're sipping on this throughout the day, your mouth is constantly bathed in acid. And so
Mm.
you are very likely to suffer from disease because those minerals are going to get pulled out of your teeth and they're never going to get pushed back in. So I really like patients, parents, kids, I like humans eating every 2 hours if we can. Trying to space things out to give the mouth a rest, to allow your saliva to remineralize, but also that's better for gut health too. And gut health experts will speak about this. There's something called the migrating motor complex, and it's a event that happens in the gut where it goes in and it cleans the gut essentially, and it gets it like reset for the next eating opportunity. But when we're constantly eating, we don't have this kick in. And that it can lead to toxin accumulation and just digestive issues too. So trying to eat on a schedule and then not sipping on your drinks all day. If you're
Mm.
going to drink something, as I mentioned, try to drink it fairly quickly and then try to just have plain water, maybe with some minerals or a little sprinkle of salt,
Yeah.
add it throughout the day to stay hydrated. But we have to stop the sipping and the snacking. It's really doing a lot of damage to us, including to our blood sugar.
Yeah, no. Speaking of blood sugar, I mean, I've been eating from what you'd said, eating every maybe half an hour or so, and having like flour and carbs to having quite a lower carb or processed carb diet, having a big meal at 12, then another big meal at the end of the day, and then not having sugar in my coffee and just sipping on some water with a sprinkle of salt in. And I didn't realize that really benefits your oral health, but it sure as hell benefited my blood sugar levels. My energy
Absolutely.
levels are so much better throughout the day now. And I used to
Yes,
wonder at 2 p.m. or 3 p.m. after going to the pub with my dad and having some chips and a Coke while I felt really like
yeah,
tired on the car journey back. And I assume a reason is because of the diet and what you're putting into your body. It makes so much sense now. But when I was younger, I had no idea. Most people don't know about this, right?
they don't. They don't.
Yeah.
Most people don't know why they feel bad all the time, and they think it's normal, and they don't know how good they could feel if there's some small
Mhm.
tweaks and being open to change. You have to want it though. You have to
Mhm.
want to feel better. I'm not here to tell you. I just give the information, and then everyone's allowed to do with that what they choose. But yes, blood sugar regulation is important, and it's interesting. So your blood sugar impacts your saliva, and you can have higher sugar content from blood sugar dysregulation in your saliva, and that can impact your oral health. So I've had patients or followers on social media reach out to me thanking me for some of my posts. One mom in particular from Australia said, "My God, you are the only one that helped me figure out my child had type 1 diabetes."
Wow.
And because his teeth were just decaying and crumbling, and it was because his blood sugar was so dysregulated and it was coming out in his saliva, like the sugar content, the glucose of his saliva was so high. But people just assume, "What are you feeding your kid? You're not brushing his teeth. Where's your fluoride in your toothpaste?" And this mom's like, "I'm doing all the things you're saying, and his teeth
Mm.
are still crumbling." Again, this is where functional dentistry comes in. We are there's so much information that we can gather from the mouth if we just look for it. And so many aren't trained to look for it, or so many just aren't open to it. But please take your mouth seriously. Your tongue health is important. Do you have a white coating on your tongue? I want people to really pay attention to their mouth because it's a little snapshot into your body. We can't open our guts up and like look inside and see what's happening, but your mouth reflects what is happening in your body. Do you get oral ulcers a lot? Do bad breath, halitosis, tonsil stones? All of these things are signs of imbalances in the body, but we ignore them. We normalize them. We just like, oh, this is just who I am, or this, all humans have this. No, you can feel better, and we can correct a lot of these issues with honestly pretty low cost, no cost changes.
Hmm. And this is quite fitting because I'm a bit clogged up right now. But what happens when you have a sore throat or blocked sinuses or a cold? Can that be caused by poor oral health? And what are some of the impacts of having maybe a flu or a cold on your oral microbiome and oral health?
Yeah, great question. So, well, it's chicken or the egg to some degree. I will tell you, kids, especially who thumb suck or finger suck, or they're just putting things in their mouth a lot, they get sick much more often because they're putting bacteria and viruses and things from the outside world in their body all the time. Um, Now, if you are a mouth breather, you do get sick more often for many reasons, but one is you're allowing bacteria to directly go right into your body, right into your tonsillar tissue. when you breathe through your nose, there is a filtration system and there's
Mm.
immune cells. There's a lot that happens up in your sinuses to try to prevent bacteria and viruses from getting in. Like the mucus, it's there for a reason. It's to hear and grab those things before they get into your body. So mouth breathers do get sick more often. Um, but if it isn't from that, and you're just sick and who knows the reason where you picked it up from, you will be mouth breathing for a while, right? You're
Yeah.
congested. So we need to be realistic. It's nice we have a mouth to back up breathe, right? But as soon as we can get back to nasal breathing, we want to do that. And especially in kids, a lot of kids they get sick, they start mouth breathing, then they get better, but now they have this habit of mouth
Mm.
breathing and then it perpetuates. And so parents, you need to it's okay to remind, "Oh, close your mouth, bud. Breathe through your nose, honey. Your nose isn't still stuffy." But I really like sinus hygiene too. So I want people to think of
Mm.
sinus hygiene as part of oral hygiene. And actually, there is a sinus
I was
microbiome.
going to ask you that. Yeah.
Sinus
No
microbiome.
way.
Yes, there is.
Wow.
And so you want to be clearing the nasal passages as much as you can. I do really like nasal irrigation, like neti potting or, with saline. There's xylitol sprays that you can get that are saline and xylitol. And xylitol it actually acts as a prebiotic and it will shift the microbiome in your sinus to be make it more hospitable for healthy bacteria. So it can change the pH of your sinus to make it better for the good bugs. So if you're sick, I might look into that. I'd look into getting some xylitol spray. I really like bee propolis too. Um, Getting a humidifier in the room. Like, we wanna try to clear out your sinuses as quickly as possible so that you can get back to nasal breathing.
Mm. Yeah. And you have mentioned mouth breathing and some of the reasons why that can cause bad oral health. What happens if you're mouth breathing when you're sleeping? And how would you know if you're a mouth breather when you sleep? You mentioned snoring, but obviously we're asleep most of the time we're snoring. So what's some
Yeah.
other signs that you're a mouth breather and why could this be a really bad thing?
Yeah. So, if you don't have someone there to help witness and watch you, um, signs could be, you wake up with a dry mouth. Like, do you wake up and your mouth's really, like, sticky and dry? Or do you wake up with a bunch of drool on your pillow? Okay. Um, and also, how do you feel? Do you wake up a lot in the middle of the night? So I think many people now are into wearables and tracking their health metrics. So if you do have a sleep tracker, like an Oura Ring or an Apple Watch or a Whoop or whatever, look at your sleep cycle. And if you are not getting into deep sleep for the appropriate amount of time, and if you're waking up a lot, my guess is you probably have an airway issue. That's usually
Mm.
the top reason for sleep disturbances. So the problem is when you're mouth breathing or you're snoring or you're grinding or you're clenching or you toss and turn a lot, it doesn't allow your body to get into full deep restorative sleep. And so you will feel like garbage. And with kids, it can manifest as behavioral issues, almost like ADHD. So a lot of children get pegged with ADHD. They even get put on medication, and really, they have an airway issue, a breathing issue. With adults, we tend to get more lethargic, grumpy, brain fog, depression, to be honest with you. So it's important. I think of all this we've spoken about, the most important thing for health is breath. What's the one thing we can't live without for just a few minutes? It's oxygen. We cannot live without oxygen for more than 3 minutes, okay,
Mm.
before brain damage is noticed. So the way you breathe, how you breathe, the functionality of your breathing cannot be overemphasized. So I encourage everyone. There's a book called Breath by James Nestor. It's the most life-changing book for so many people. He writes it so interestingly. It's not boring. I encourage anyone who's interested in this airway breath stuff to look into it. It's important to note humans are obligate nasal breathers, and if you look back at ancestral skulls, our jaws were wide and big, and our teeth were straight, and our tongue could fit in our palate, and we breathed through our nose. But what has happened because of these changes in our food and the Industrial Revolution and the Agricultural Revolution, we're shrinking. Our skulls are shrinking, they're compressing, they're getting more narrow. And because of that, our teeth are getting crowded, our jaws are getting too small, and our tongue doesn't fit in our skull anymore, in our
Wow.
jaws. So the tongue now slips back into the throat when we're sleeping, or it sticks out, lays low, and kind of sticks out. Like there's a character in the US, Napoleon Dynamite, if people know. He's like forward head posture, mouth open, mouth breathing. You know that look that kind of how you look when you're sick, right? You look like circles under your eyes. You're opening your mouth to breathe. That is not normal.
Mm,
Um, and that is causing a lot of issues. But this is why functional dentistry will intervene early with kids. So if we start seeing these issues, there's things you can do with retainer therapy to help just really young at 4, 5, 6 years old to help grow the face broad and wide again so that the tongue fits, so that the teeth fit. And you can avoid braces, but we're not doing this for aesthetics. We're doing this for function. We're doing
mm,
this for airway. And it's important to note too, the roof of the mouth's the floor of the nose. So if the palate is narrow, your sinuses are narrow. Your septum might be deviated. So you're going to have a harder time breathing through your nose. If you can broaden and widen your face and your jaws, not only does your tongue fit, now you can literally breathe through your nose more easily. And there are really cool things they're doing now in adults for this too that are fairly non-invasive. So, people can look into that, but again, if you're interested in it, I would check out that book, Breath. Um, but your airway health's so important, and so, um, I would say either ask someone to observe you sleeping, record yourself, or, look for the things I spoke about, or a wearable. Of course, there are at-home sleep studies now too that people can have, like Watch Pat is one, at least here in the US, that you just take home, you put it on, and it will tell you, like, how many episodes of apneas are you having a night. It's important for people to understand as well that sleep issues are on a continuum. And so sleep apnea is end stage disease. Now, remember, we
mm,
don't want end stage disease. We want to catch things upstream. So all starts with mouth breathing, and then that can lead to sleep disordered breathing, dysregulated breathing, etc. And then move toward apnea, true apnea. And again, we don't want to get there if we don't have to. So if we can catch it early, that's great.
yeah, some really, really important stuff. And what do you think about mouth tape or the nasal strips
I
for
love them
improve?
both.
Yeah.
I love them both. I mouth tape every night. So, and I like nasal strips too. I don't feel I need them, but for people that need them, they're amazing. Anything you can do to open the airway and get your nose working, I think's great. So, mouth tape, I just ask that everyone I really like people to get screened first before they just jump into it. There really isn't any harm in it unless you truly can't breathe through your nose or you truly have sleep apnea. So just be smart about this. There is something called the lip seal test, and it was created by Shrush Jagi, who's an ENT out of um, the Breathe Institute in LA here in the States. But if you can breathe through your nose for 3 minutes, so you can time it, like close your lips or put tape on your mouth and time it. If for 3 minutes you can breathe through your nose and you don't feel panicked, you don't feel sympathetically overdriven, you can probably tape overnight. But what I suggest if people are interested is just build up to it. So, like lip tape for a few minutes, and then lip tape while you're cooking dinner one night, and then lip tape for a show, and then lip tape for a movie. And then if we can get
Mhm,
to that point, you can lip tape at night. Now, if you tape at night and you rip it off in the middle of the night, then you have dysregulated breathing. You
mhm,
need to be working with someone on the why. And that could be a true blockage. It could just be you need breathing rehabilitation. And this is a very big missing part of the airway conversation is a lot of patients need actual physical therapy to relearn how to breathe. We breathe way too fast, way too shallow, way too high up in our chest. We're supposed to be slow, diaphragmatic
Yeah. Yeah.
breathing, but we're all rushing around. We're breath holding. There's something called email apnea. It's it's a real thing.
No way.
Email and you hold your breath because you're probably you're in fight or flight. You're like,
Yeah, yeah, yeah.
what do I have to do today? So we're not breathing well. And it's
Mm.
really important to focus on your breath. I
Mm.
think it's foundational. I think we'd have a lot of health improvements on this planet if we could just get people breathing better.
Yeah, it's probably one of the most 80/20 things to do, and it's definitely
Yeah.
something I'll look into because I feel like I do breathe through my nose, right? But then I sleep best when my mouth's open but I'm breathing through my nose. But obviously when I become unconscious, maybe it switches because I do sometimes wake up with a lot of saliva on
Yeah.
there. So something I need to look into.
You may be like me where I really do breathe through my nose, but my mouth pops open,
Yeah, yeah.
right? And that is why I tape. So that for me is like a jaw alignment issue, and I'm not gonna go have jaw surgery to fix this. So it's so much easier for me to put a little piece of tape on my mouth to keep my mouth shut because it's gonna keep my mouth healthier. I'm not gonna lose saliva, maybe get cavities, gum disease, but in the event that I roll over and then I start breathing through my mouth, it kinda nips that in the bud. It's gonna make me always breathe through my nose all night. And I will tell you, since I started doing this, and I've been lip taping or mouth taping, I think it's been almost 6 years now. I mean,
Mm,
I sleep so well. My sleep scores are like 96,
nice.
98. And I will tell you if I'm camping or traveling and I forget tape, I sleep terribly.
Yeah,
It's so much so if I'm at a hotel and I've forgotten it, I will like call for Band-Aids and they don't work that well, but I'm, like,
yeah.
desperate, right? And I'm like, "I have to do something because I need to sleep well. I wanna feel good in the
Mm,
morning." And once you start sleeping really well and then you get a bad night of sleep, you realize how much it impacts you. I mean,
mm,
I think unfortunately so many patients are just living in this chronic state of sleep
yeah.
deprivation that you don't even know how bad you feel. Um, and you just think it's normal. You think, "Well, it's about being an adult, and this is just the way life is as we age. It's not doesn't have to be that way. You can feel incredible. And I think so much of it comes down to your airway.
Mm, and what tape or nasal strips do you often use or recommend
Yeah.
to people?
Yeah. I like a brand called Hostage Tape, which gets mixed reviews on the marketing, but
Really?
it works the best. It's like a fabric.
Yeah,
I don't love the plastic ones because I just don't like plastic sitting on my body all night. So
yeah,
I love Plastic Shape, and they have the nasal, strips too. Otherwise, some people will just take, like, 3M has, like, a medical tape. It's like the white tape, and you can just put it vertically this way to keep the lips closed. That works really well. I think, men, especially men, have to deal with facial hair.
yeah,
And so I find hostage shape works really well for men especially, but I like it too. I really like it too, and it's a fabric, so you can breathe through it if you need to. And there's others that have slits in the middle because some people get very nervous about this, but
yeah,
I can assure you, our bodies are responsive. If you're not just gonna not breathe and, like, pass away in bed. You're gonna wake up and pull you're gonna take off the tape. But again, I don't advise it if you have sleep apnea or if you have, like, a CPAP. You have end-stage disease, and you definitely wanna be working with a provider on this. I will say more sleep doctors I'm hearing are prescribing sleep tape with the CPAP so that it's forcing air into the nose and not into the mouth, but do not do that without your doctor talking to you about it first, please.
mm, yeah. And you mentioned the sinus microbiome. I was wondering if lips relate to any of your work, whether if you have like spots on your lips or cracks on your lips, if you've studied that, if that's part of your field, and what
Oh,
does that indicate?
yes, absolutely. That's part of functional dentistry. So, um, nutritional deficiencies. So again, the mouth tells us so much if we pay attention. So cracks in the lips in the corners of your mouth, that's a sign usually of zinc deficiency. or B6, B12, or B2, just B deficiencies. Um, Interestingly, if you look at your fingernails, if you see little white lines, that can be a sign of zinc deficiency too. And you might
Oh, okay.
notice that like halfway down or at the tip, that just means during that moment of your life, you were zinc deficient.
Wow.
So your nails tell us, or they tell us a lot too, your fingernail. So that's for another podcast. But yeah, so cracked lips can be a sign of deficiencies. Bleeding gums can be a sign of vitamin C deficiency. Think of scurvy,
Yeah.
as well as B vitamins, collagen deficiency, protein deficiency. We haven't even touched on hormones. I mean,
Yeah.
hormones influence everything too. Perimenopause, menopause, puberty, pregnancy. Again, maybe I'll have to come back and speak of this, but
Yeah.
your tongue, if you have burning tongue or a big red bulbous tongue or metallic taste in your mouth, those can all be signs also of it's usually zinc, vitamin B deficiencies. We can see iron deficiency, anemia in the mouth. If the gums and the mucosa, the cheeks look pale, kind of gray, that can be a sign of iron deficiency. Um, Teeth, if you're getting cavities, that's a definite sign of vitamin D deficiency. Um, Maybe K2 also, so fat soluble vitamins, certainly calcium, phosphorus, and minerals, and magnesium. So the things that I think so many should consider supplementing, work with your doctor, is vitamin D3, K2, and a very high quality magnesium blend.
Wow.
Maybe some additional minerals, like a really high quality multivitamin minerals, because those are just so depleted in our day to day. Our soil is depleted, which means our food is depleted of nutrients, and then we are an inside culture. Whether we try to get outside and see the sun and set the circadian rhythm, all of that, we are inside all day, and so unless your kids are, like, in forest school and you're literally outside a majority of the day, I worry about vitamin D deficiency, and I do believe tests don't guess, um, but estimates are, like, up to 80% of the global population's vitamin D deficient, and
Wow.
what's interesting is, around the turn of the century, the 1900s, dentists were really talking about vitamin D deficiency as the root cause of cavities, and that shifted all when water fluoridation started. But I will tell you, there's so much research. You can jump on NIH or PubMed about vitamin D deficiency and dental decay. I mean, it's bone health essentially, right? It's the same process. So, think of rickets. It's a big
Mm.
deal. So, I want everyone testing their oral microbiomes, and I think testing their vitamin D. If there were two take homes of things that you could level up with is that because with vitamin D, you could say, "Well, I'm outside all the time," or maybe you do supplement, but is it enough? We don't
Mm.
know. Then you might have a gene mutation, the VDR SNP, that's impacting how you utilize, and make vitamin D bioavailable. So you might be chronically deficient and you might just need to be supplementing more. So, I don't like guessing at these things. I like to have information and data.
Mm. Definitely. And as kind of ending chapter, what are some of the key things the audience should take away from this conversation to make sure they're cavity free for life and have a healthy oral microbiome? What are the few 80/20 actions people can take straight after this episode?
Yeah, we can recap. So I think food first. It's the most foundational, most important. So do the best you can, chip away at it. It can take time. But we have to clean up our diets, and
Yeah.
we have to start getting back to the basics and eating the way we were meant to eat ancestrally, which is more of the things we spoke about, the whole foods, and less of the bagged foods, the boxed foods, the things that are quick and convenient and delicious, but not the best for our whole bodies, including our gut microbiome and oral microbiome. I would then say hydration. Your spit matters. The quality of your spit matters. You want minerals. Um, so add minerals to your water. Add a sprinkle of high quality salt to your water. Our water is so devoid of what we need to absorb it and utilize it. So We really should be adding minerals or salt to our water. Um, Airway health is key. How you're sleeping, how you're breathing is so incredibly important. I would say, you know, your hygiene does matter. Um, so floss, please floss. Floss every night. And prioritize it. I really think it's more important than brushing. You could look into adding tongue scraping too. I don't like to overwhelm with all these protocols. I
Yeah.
like to keep them fairly straightforward. But you can do a floss, brush, tongue scrape routine at night. It should take you 2 minutes, even less. I know dentists will say brush for 2 minutes, but, like, beggars can't be choosers here. Even if you did 1 minute of that condensed routine, profound benefits than just doing none of it, right?
Mm,
Um, and then I would say too, just have data, consider microbiome testing, consider vitamin D testing. If you do have cracked lips or deficiencies or ulcers in your mouth, ulcers is another thing we didn't speak of, but chronic ulcers can be a sign of Crohn's disease, celiac disease. It can be a sign of nutrient deficiencies as well, autoimmune triggers. So don't ignore if you get ulcers in your mouth all the time. It could be something in your toothpaste called sodium lauryl sulfate, SLS, triggering that. So I think we need to listen more. We need to observe more. I think we're so busy in our day to day. We just are flying through life and we're not paying attention.
mm,
And I ask everyone to slow down a little bit and look yourself in the mirror at night. Have a check in with yourself. This is a good mental health exercise, too. Give yourself a high five, pump yourself up, reflect on the day, but look in your mouth. It is the gateway into your body. Or
mm,
maybe you do this in the morning, whatever works for you. But I really, really want people thinking of that. It's kind of a beautiful thing. We get to see what's happening inside our body by looking in here. So I would say just don't ignore it.
yeah. So much wisdom, Stacey. And the final question for you is, if you had one piece of advice for your 20-year-old self, what would it be and why?
Oh man. Um, it would probably be don't care so much about what other people think.
Yeah.
I really lived that way so much, trying to please others and do the right thing and impress the adults and do what I think other people thought I should be doing. And I misstepped a little bit because of that, because I wasn't true to my heart. I wasn't trusting my gut,
Mm,
which is a real thing, right? So
yeah.
I would say that be true to yourself. You know yourself better than anyone.
Such good advice. Dr. Staci Whitman, ladies and gentlemen. Stacey, I wish we could have done this for hours. There's so much to uncover, but the wisdom you shared in this episode, even if it was just in a short space time, was more than enough for myself and definitely the audience to uncover and change their behavior. There's a lot of things we need to do as a society to change our behavior and really improve our oral health. So I really appreciate you coming on the show and sharing the wisdom, because there's a lot of things that we're not told about or not taught and aren't aware of. So I really appreciate it. And where can people go if they want to find your work?
Yes, amazing. It was super fun. I'm happy to come back on anytime. Um,
Awesome.
So I have a website, drstacy.com. We'll put it in the show notes. There, I have a lot of information. I have online consultations, but I do have a newsletter that I spend a lot of time on each week trying to unpack these concepts we just talk about in more detail, more specifics, more protocols. So go sign up for my newsletter, please. I'm also on social media. So I mostly live on Instagram, but I'm also on TikTok and YouTube shorts and all of that. And that's Dr. _Stacy. Um, People come see me in person in Portland, Oregon. I do still actively see patients. And then to help everyone, because what happens is people listen to these podcasts and they go, cool, where can I find a dentist like this?
Mm,
And there aren't many. And so I have helped co-launch the Institute for Functional Dentistry. It's launching in January. We're allied partners with the Institute for Functional Medicine. This is where dentists can go and get functional medicine trained and functional dental trained and get a proper certification. Um, So be patient. It's going to take this first cohort 18 months to 2 years to go through this residency level program. But then we're going to start building this database of patients. And this is global. So these are dentists from all over the world that can take this course. So we are working on it. We're trying to help get more dentists to you that think this way. And so you can check out the Institute for Functional Dentistry and follow along there too.
That's amazing. And you're amazing, Staci. Really, really appreciate it. Thank you for coming on the show.
Thank you, Jacob. It was super fun.
Also, if you've made it this far, you're likely not just a listener, you're ready to be the host. You felt that sense of intimacy and connection with our guest today, and you would like to get the same on your own show and start your own dream show. But you're worried about landing dream guests and all the complications and the mess that is often spoken about when starting your own podcast from scratch. You think starting a podcast requires a huge budget and a whole team, right? That is absolute nonsense. My pro remote podcast blueprint is the ultimate key to skipping the outdated advice and building a high quality, high impact show, even for under $100. It provides the proven strategies and AI templates that I use to this day that you will be able to use to reclaim your time and creative control. And this is a strictly limited opportunity. Don't dilly-dally because there's limited spaces. We've already got one student, Rob, who's joined. That means there's only a couple more spaces to get the Pro Remote Podcast Blueprint course half price. And you need to act very, very fast because this is a limited offer and you're very, very early. So if you want to get the early bird discount like Rob has and get the results by watching the course that goes through the exact step-by-step blueprint that I use to this day to create these episodes that you've just watched and get to the success and become Europe's fastest growing under 21 podcaster, and also join live weekly calls with me and use the AI templates and email templates that I use every single day to get the results and just get all my secrets without getting any of the mistakes and failures that I've made, then top link in the description is for you. And if you're ready to launch your own show and get personalized one-to-one help from me and copy my blueprint, which no other podcaster has shared, then I'll see you there. I'm rooting for you. Goodbye. Hope you enjoyed the episode too.